Hi, I'm Leanne and I'm an occupational therapist at the Norfolk and Norwich Hospital. I work in outpatients in the hand therapy team. So we see patients who are referred from orthopaedics or plastic surgery who may have had surgery to fix broken bones or repair cut tendons or nerves. But some patients don't need surgery and are managed conservatively with hand therapy. We make splints, give exercises and help people get back to work and to normal life. And this is my video diary. Members of the public will also probably see these signs at the entrances to the hospital, just alerting us to the local COVID state level. This is not to be confused with the national tier system. This is an internal system that lets staff know how many numbers of COVID patients are in the hospital, and in particular in critical care, so that we can plan services appropriately, redeploy staff, and ensure that the right level of support is directed to the right places. I'm going to put my mask on and head in. Another thing that members of the public will see are lots of hand sanitising stations, lots of Clinell wipes everywhere, wiping down surfaces. Pre-COVID, we would never have thought really of doing telephone calls or video calls. Everyone was seen face to face. I think we do now realise that for some people it isn't detrimental to their care to have a telephone call or a video call, but for those who have multi-trauma, where things aren't quite clear over the phone, it's sometimes very difficult to get an accurate picture of how a hand is moving, how it looks by a telephone call, because it's hard to describe sometimes for patients. I think going forward we know it's here to stay, so I think we've adapted actually really well. It has taken quite a long time to get used to, but I think we realise that it's here to stay, so we have to make the most of it and make it work for us and for our patients. I think one of the biggest impacts that COVID has had on our team is how fragmented we are now. Before COVID, we would all be working in the same clinic area. We'd lunch together, we'd chat about, difficult cases together, we'd bounce off each other, there'd be banter. And since COVID and having to reduce the number of people in each clinic room, we're much more separated. There's a proportion of the team that have needed to work from home for their own health risks. So there's been this divide between on-site staff and home working staff. And we've just felt very fragmented because of the restrictions on meetings and numbers of people in meetings. Sometimes even if we're all in the building, we haven't all been able to meet in the same room. You can feel quite isolated, unsupported, particularly for junior staff or people that are new to the team, not coming into that kind of big team environment because there's fewer people around and we're scattered all over the place, I think has been very challenging. So we're gradually coming back to our own work environments and trying to kind of pick up the pieces of the service and move forward and get things back to a new normal. Although we appreciate that it's never really going to be how it used to be. We'll always have the restriction on numbers in clinic rooms, spaces between patients, more cleaning time. I think it's, I suppose we're all now trying to adjust to how life will be going forward. Every single member of the NHS, all the key workers, the parents that have had to do homeschooling, we all need a break. And from my point of view, our break will come when we can see our family and friends again. We can go out, we can socialise, we can have some fun and just get back to normal. So, no risk taking, don't be complacent. Let's get back to some sense of normality, please.